Welcome. My name is Dr. Daniel Barton. I'm a child, adolescent, and adult psychiatrist and medical director of the Tennessee TMS Center. You're probably here because you're wondering what TMS is. TMS stands for transcranial magnetic stimulation. Successfully treat issues like anxiety, PTSD, and OCD. And research is finding the use of TMS to be beneficial with individuals dealing with substance abuse disorders, as well as with some of the symptoms of pervasive developmental disorders like Asperger's or autism. Let's talk about how TMS works. Our brains help in managing our thoughts by creating pathways that communicate with each other via electrical and chemical messengers. Each type of thought or feeling coincides with particular pathways or roads that these signals travel along. The more our brain practices certain pathways, the better it gets at doing whatever it is that we practice. It's kind of like muscle memory, but for the neurons in our brain. Now let's look at how treatment works. In TMS, a magnetic coil is placed over the head and uses an electromagnetic field which provides for enough energy to cause the neurons at the surface of the brain to reach what we call an action potential. Dominoes, those neurons send messages that cause other neurons to fire, which cause other neurons to fire, and so on and so on. This roadway of neurons reaches deep areas of our brain, specifically the limbic system. Practices or works out those known pathways of our brain that are associated with being more happy, being less anxious, and being more relaxed and content. Regular TMS treatment will practice that positive pathway 3,000 to 5,000 times. The more your brain practices these positive pathways, the more of an expert your brain gets at feeling happiness and joy, and the less of an expert it gets at feeling depressed. TMS is a non-invasive, simple outpatient procedure. There's no anesthesia, no need for hospital stays. During the procedure, patients can listen to music, watch movies, or chit-chat like normal with family or clinical staff. Patients can drive themselves to our clinic, receive treatment, and then drive themselves back to work, school, or just go about their day as planned. And what about side effects? This is one of the great things about TMS. Because it is a non-systemic focal treatment, TMS doesn't have any of the traditional side effects of medications, which have the potential to cause weight gain, sexual dysfunction, decreased sex drive, memory problems, nausea or stomach aches, problems with sedation, blurred vision, and dry mouth. The most common side effect of TMS is a mild headache during the initial sessions, which disappears over the course of a few days. Most patients, however, report no side effects. TMS is a wonderful option for anyone who has not benefited enough from medications, or for anyone who has struggled with the many side effects of medications.